Very much, Mahalani. And now joining us from the University of Hawaii's Economic Department, the chair of the department is Jerry Russo, and he's, of course, with the UHERO. It's part of our weekly series with the University of Hawaii's Economic Research Organization. Sir, thank you very much for being here.
Thank you, Dan. Thanks for having me.
And, Jerry, you know, the big issue coming up, especially with Wednesday's address to the joint session of Congress, is Obama's health care reform and his attempt to reform health care. And we wanted to ask you a couple questions about that. Now, first of all, what is the Obama administration doing to try to reform health care?
Well, the first thing they want to do is they want to expand coverage, expand the Medicaid program, subsidize the self-employed, require individuals to buy it and families to buy health care. But they also simultaneously want to control expenditures by inducing greater efficiency for the health care providers and the insurance industry.
And these are pretty lofty goals, but a lot of people thought that this is something the Obama administration could really pull off because they control both houses of Congress. What are their chances of pulling off these goals?
Well, I think politically they'll be able to do it, but it'll probably cost more. They won't be able to lower expenditures. It's at least going to cost another $100 billion a year to do this. There won't be enough efficiency gains to compensate for the expansion.
And what are the implications for Hawaii with this reform? Because Hawaii already is pretty well known for its
well, we have an employer mandate. We have a lot of people covered. There is a provision in the bill, the current bill, that they would be grandfathered in, and so that individuals who have current coverage, there should be no change to them. But there's, I think, some very big questions with regard to the state's participation in the Medicaid program. The federal government's going to have to provide extra funding to do the expansion because the states won't be able to fund their half. And, you know, Hawaii's having a lot of difficulty right now. And then there's a big issue about the public option. Under our Prepaid Health Care Act, the large employers are required to, if you have full-time workers, to provide coverage in the private sector. Will they be able to opt out and go into this public pool if it's established? That would be a huge change to our insurance market if that happens.
And the public option and these so-called death panels, there's a lot of rumors and innuendos and facts that are out there, and I guess the president's going to really try to separate fiction from fact on Wednesday, or at least his version of what's fiction and what's fact.
Well, I don't think the insurance industry doesn't want to lose the business to a public option. When they did the Medicare program in the 1960s, it basically drove the private sector out of the health insurance market for the elderly. And so it could be fairly dramatic. But they're trying to induce greater efficiency through competition by providing the public option. For Hawaii, it's already, I think, fairly efficient, and premiums are substantially lower than they are on the mainland. So it's not likely to be a dramatic change.
Yeah, but the Hawaii model can't be used on the mainland, though. Is it because we're just a smaller state?
Well, I think it's not politically feasible to induce an employer mandate. So they're going to have a player pay model where if you don't provide insurance on the mainland, you'll have to contribute some money to the insurance pool, a tax or a fee. And that'll be subsidized. So there doesn't seem to be enough political will to require employers to do it. GM basically went out of business because of their health insurance plan.
Right.
So there's not enough support to have a nationwide system like Hawaii's.
All right, sir. Well, thank you very much for joining us.
Thank you very much.
Appreciate it. Of course, Jerry Russo of the UHERO department there at the University of Hawaii is the chair of the business department there. Not the business department. I apologize there. But in any case, moving on, we've got to leave you with this island image, and we'll be back with more news. And this is from Sarah Christensen Chamberlain, and it's called We. It's a beautiful photo of the sunrise at Mauna Kea. It is 6:41.